At this very moment, worried parents are carefully watching a severe respiratory virus that is spreading quickly around the United States. We're taking action for you right now with the latest from the CDC and a local medical expert.
Spreading very rapidly. No one has immunity to it because it was so rare in the past. And so when you get infected with it, you're going to get common cold symptoms, fever, runny nose, headache, cough. The two groups that seem to be at the biggest risk for this particular strain of virus are the asthmatics, because it causes a bronchiolitis or inflammation and swelling of the airway tubes, and then children under 5.
Dr. James Orlowski, head of pediatrics at Florida Hospital Tampa, says a respiratory virus called Enterovirus-68 that has sickened more than 1,000 kids in about a dozen states is likely to come to Tampa, if it hasn't already.
We have 5 asthmatics in the hospital right now, 3 on the ward and 2 in the ICU, and we're testing all 5 of them for the Enterovirus-68. And so far we don't have any results back on them.
Symptoms can progress quickly into wheezing within 12 hours of first getting symptoms. So what do you watch out for?
So what do you need to watch for? The child is suddenly making whistling noises when they breathe, having difficulty breathing, any little bit of color change toward the blue area around the lips or around the eyes are concerned, and the child needs to be seen.
At a children's hospital in Denver, Colorado, officials say between August 18th and September 4th, doctors saw 900 pediatric patients with symptoms of this respiratory virus in the ER. And of those 900 patients, 86 had to be hospitalized.
There's no need to panic at this stage. I mean, to a large extent, it's going to be very similar to many of the childhood viruses that people are used to seeing.
Well, no deaths have been reported that the CDC is aware of, but the breathing issue is what parents need to keep an eye out for. If your child has difficulty breathing, they need to be seen by a doctor ASAP. The CDC also advises us all to follow those usual common sense steps. Wash your hands with soap for 20 seconds, disinfect common surfaces, and Dr. Orlowski adds, have your child wear a mask if they get sick, even if you're not sure what they're sick with. This virus is likely spread the same way a cold is, through droplets of saliva or mucus.